Hey everybody, welcome to Dynamic Performance and Rehab. I'm Dr. Peter Dianasopoulos,
And I'm Dr. Carl Bush.
and we're going to go over on why we don't take insurance and how it benefits you. Go ahead, Carl.
Well, so the first things first is the reason why we don't take insurance. It actually limits your care as the patient. And the first reason why is because if we were a traditional clinic and we were taking insurance, our reimbursement rate would be so low that we would have to see a high number of patients just to make a profit. And so if you go to one of these traditional clinics, they're seeing 3 to 4 to 5 patients in an hour just so they can make a profit based on your patient care. For us, we're seeing you one-on-one for 60 minutes. And so what this does is, in a traditional clinic, you're only seeing the therapist for 10 to 15 minutes tops. And again, like I reiterate, you're seeing us for 60 minutes. And insurance can actually dictate the type of care that they provide. So if you go to a doctor's and your referral is only for the shoulder pain, their PT can only see you for that shoulder pain. So they don't care if you have hip, foot, knee pain. They can't really do anything about it. With us, we're not confined by the insurance or by what the doctor referred you as. We can do whatever we need to do to kind of to give you the care that you need. Okay. And then next, so all money is not lost. While we don't take insurance directly, what we can do is we can provide you what is called a super bill. So what you have to do is you have to call your insurance company and ask what your out-of-network benefits are for physical therapy. And a lot of times it can actually be comparable to what your in-network benefits are. Then what we will do is we'll provide you a super bill for the services that we provide, and you directly submit that to your insurance. And what they will do is they will reimburse you directly for that money, so it's cash in your pocket.
Right. So, how do we compare to the other bigger businesses, right? So we got, a little picture of Rocky, Ivan Drago here, we're the underdogs, and, the bigger places are, corporations of Ivan Drago over there. So, like Carl said, we're 1 hour, $115 per hour. It's one-on-one. You're only going to see us. There's no text. There's no aides. You're not going to be delegated care to somebody else, and the therapist isn't going to only be there for 10, 20 minutes at a time if you're lucky in that visit. And they always bill for half-hour visits. Their copays are generally $25 to $50 on average. Okay, so when they take you for a plan of care, they'll take you for 12 to 18 visits, usually on total, and that's 2 to 3 visits a week mostly, and sometimes it's more. If you're going more than 18 visits, it could be months of that, and they're paying a $50 copay. You got $100, $150 a week in the copay already. And then for us, we're 1 to 5 visits on average, and that's spanned out every other week, or sometimes a little further apart depending where you are in your case. And in terms of price per minute that you pay with the therapist, the time you have with them, we're always going to be $1.91, okay? And that's before any reimbursements of the super bill, like Carl was saying before. And the other places in the traditional clinics, it's $2.50 all the way up to $5 per minute that you're going to pay with that therapist. So kind of wrapping this all up, we don't take insurance because it'll benefit you in the long run, and it'll help us treat you the way you need to be treated, okay? We can't be dictated on the way that the insurance company wants you to be treated, okay? And then you can still get reimbursed with the super bill, like Carl said, and the price per minute is always cheaper. Like I said earlier, we're $1.91 before reimbursement. And then our model is based on treating you as an individual, and it's really focused in on your specific needs and changing your life, okay? So anything you want to add, Carl?
Yeah, if you want to get in contact with us, you can find us on social media, Facebook, Instagram. You can go to our website, give us a call, shoot us an email at any time if you have any other questions about our insurance and our little presentation here. All right.